let's say you're going to the grocery store, but you realize you left your keys in your room. You go up to get them and then walk into the room and look around for a second and realize you completely forgot why you even came here in the first place. We all know how frustrating this can be, right? But this scenario is totally normal and is something everybody experiences from time to time. And besides causing you to take one more trip up the stairs to your room after you remember again, it doesn't throw off your day too much. When problems remembering, or problems with your thinking skills in general, become so severe and so common that they actually interfere with your daily life, it might be diagnosed as dementia. Dementia, though, is not a specific disease. What do I mean by that? Well, it's more of a general term that describes a range of potential difficulties with reasoning, judgment, and memory. For example, somebody with dementia might have troubles with speaking or writing coherently, or understanding what was spoken or written. They also might have trouble recognizing their surroundings, especially when those surroundings should normally be very familiar to them. Planning and performing tasks that require multiple steps can also be difficult for patients with dementia, even tasks that you might think are really simple, like getting dressed and eating. These can become a serious challenge for patients with later stage dementia. And to make matters worse, many times patients aren't even aware that they're experiencing any troubles or any sort of cognitive deficiencies at all. Now, dementia is most common in the elderly, especially after age 65, but it is certainly not a normal part of aging. So dementia, in very general terms, is something we use to describe when someone has troubles learning, remembering, and communicating. But where does Alzheimer's disease fit into this? Well, Alzheimer's disease is a type of dementia. Specifically, it's what's known as a neurodegenerative disease, and accounts for about 60 to 80% of all cases of dementia, affecting about 5 million people. So if we look at neuro, we know that this refers to the nerves of the nervous system, or basically your brain, and then degenerative, or degeneration, means to decline or to deteriorate. So with Alzheimer's disease, there's this deterioration of your nerve cells in your brain. And this brain of yours houses about 100 billion nerve cells, which are also called neurons. And these guys communicate using 100 trillion connections. That's a lot. Now, this communication and those connections are what control essentially every other organ and every other function in your body, not to mention your thinking abilities. Unfortunately, though, the main type of cells that Alzheimer's disease targets and affects are these precious neurons. And depending on where the affected neurons live in your brain, different functions of your brain can be affected. For example, if nerve cells in this area of your cerebrum are affected, you might have trouble solving problems or making plans because these cells help you do those things. Or if the neurons in this area are affected, you might have problems remembering something or storing new memories. And as Alzheimer's disease progresses, more and more of these neurons die and your brain tissue actually begins to shrink due to this loss of nerve cells. Alright, so nerve cells in your brain are destroyed in Alzheimer's disease, but how are they destroyed? Well, unfortunately, answers to seemingly fundamental questions like these aren't really fully understood yet. But scientists have pinpointed a couple possible culprits that usually seem to be involved, and these are called plaques and tangles. Plaques are like these weird, abnormal clusters of protein fragments that build up between neighboring neurons. So this is a normal group of nerve cells going about their business, communicating and whatnot. With Alzheimer's disease, these plaques start to form in between these neurons, which is thought to make it a lot harder for them to communicate. Now, besides plaques, the other hallmark of Alzheimer's disease are called tangles. Unlike plaques, though, these guys are found inside the neurons, and most of these are made up of a protein called tau, and tau proteins are helpful, usually, but in Alzheimer's disease, they're all twisted and abnormal, which ultimately ends up hurting the cells. Okay, but we still haven't said why these plaques and tangles form. Well, again, that question's still a huge, huge area of research, and is something scientists continue to gain insight on, but have yet to completely understand. So Alzheimer's disease, vascular dementia, Lewy body dementia, and every other type of dementia causes damage to your brain cells, right? Which in turn causes some difficulties with various things your brain controls, like memory, language, reasoning, and judgment. But a lot of the time, these signs and symptoms can present themselves slightly differently. Since Alzheimer's disease accounts for the majority of dementia cases, and the other forms can often overlap anyways, the main focus here will be on the symptoms and progression of Alzheimer's disease. Dementia and Alzheimer's disease typically develop over the course of years, but the speed at which it develops can vary pretty dramatically, from 4 years in some patients, 8 in others, and even as high as 20 years in some cases. We're going to go through some of the general stages of progressing Alzheimer's disease, but considering that it's such a gradual disease, it's actually really tough to classify this progression. And it's important to remember that there are no clear-cut or well-defined stages, and many of these stages that we'll go through can even overlap. But with that said, there are a few models that are used for the progression of Alzheimer's disease, and we're going to sort of combine the definitions from a more broad 3-stage model and also the more specific 7-stage Reisberg scale. So from the 3-stage model, we have the very early to mild stages of Alzheimer's lasting about 2 to 7 years. And then if we look at the Reisberg scale, stage 1 is simply no impairment. So your memory and cognitive abilities appear normal, especially to everyone else. If there are any impairments, they might only be slightly apparent to the patient themselves. Stage 2, however, is a very mild cognitive decline, so maybe they have some trouble remembering recent events or information, but it could be more subtle things like forgetting a word or misplacing things. And again, at this stage, these lapses and changes in thinking aren't usually detected by friends, family, or even medical personnel, especially considering half of all people over 65 begin noticing problems with concentration and word recall just as a normal consequence of aging. Stage 3 is signs of early confusion and mild cognitive impairment. At this point, subtle difficulties can start to impact their daily life. The patient might consciously or even subconsciously try to hide these issues. They might have trouble retrieving words, remembering what was just said or read, and planning and organizing, which can all start to affect life at home or at work. It can still be difficult, though, to diagnose Alzheimer's at this very early stage. Now, stage 4 is considered mild Alzheimer's disease. This stage lasts about 2 years, and during these 2 years, things like financials and math start to become very challenging. And the ability to remember recent events and what was just learned becomes increasingly difficult. The patient might have trouble carrying out tasks, especially if there are specific sequences, like cooking or driving. But the patients are still usually able to recognize their family and friends, although a diagnosis at this stage is usually accurate. Stage 5 is considered early dementia to moderate Alzheimer's disease. In this stage, cognitive decline starts to become more drastic, and the patient requires assistance. They'll probably have trouble remembering things like address or phone number, and can be disoriented very easily regarding the time or place. Decision and judgment skills can also be affected, like choosing the appropriate clothes for the day or season, and so the patient may need increased supervision. This stage can last an average of about 1.5 years. Stage 6 is considered moderately severe Alzheimer's disease. And in this stage, there's a significant lack of awareness of present events and this inability to remember the past and carry on a conversation. And they'll likely need help with basic daily tasks like getting dressed, eating, and going to the bathroom. The patient will likely be unable to recall names of family members, but will likely know that they're familiar. This stage lasts about 2.5 years. In the final stage, or stage 7, speech becomes severely limited, and we see a serious decline in basic abilities. Even movement abilities begin to be affected as the disease has started to spread to those areas of the brain. So eating, walking, sitting, or even standing up all start to fade. And patients will likely need extensive assistance eating and drinking, as they can lose the ability to discern when they're thirsty or hungry. And so they need total assistance around the clock for all functions of daily life and care. And at this stage, due to these inabilities, they become much more susceptible to secondary complications, diseases and infections, especially pneumonia and falls. And this final stage can last from 1 to 2.5 years. But again, it's very important to stress the flexibility in this timeline in these stages. Not all patients with Alzheimer's will experience this exact progression, and some may deviate significantly from the expected duration with each stage and the disease itself. So there isn't one standalone test that will show whether someone has dementia or Alzheimer's disease, since the typical symptoms like memory loss, confusion, and others can have a whole slew of potential causes. That being said, it's not usually diagnosed until a complete medical assessment is performed. But what all does that entail? Well, first off, a healthcare professional might take a look at the patient's history. They'll try to gather information from the patients themselves, as well as from their friends and family. They'll probably ask questions like, what kind of symptoms have you noticed, or when did you start noticing them? How often do they happen, and have you noticed them getting any worse? They'll also try to evaluate the patient's emotional state. A lot of the time, the patient might be completely unaware of their current state, or they might be in denial about it. And this can be tough because sometimes even other family members will deny its progression, because many of the early signs of dementia also tend to look just like normal signs of aging. And this is just another reason why it makes diagnosis of dementia very, very hard, and why we have to rely on other methods of diagnosis as well. So a physical examination can also be done. In these, your doctor will check things like your hearing or your eyesight, your heart and your lungs, your temperature, your blood pressure, and your pulse. And they may also take things like blood and urine samples. Information from these can help the doctor figure out if there are any other underlying health issues that are causing or contributing to the dementia itself, like heart problems and vascular dementia, or if there's another condition that's mimicking symptoms of dementia, since other conditions like anemia or depression, infection, diabetes, kidney disease, and others can all cause dementia-like symptoms like confused thinking and memory problems. But besides physical exams, a neurological evaluation may also be done. And this will look at the patient's nervous system, and will test things like balance and sensory function using lights, and also your reflexes, using that tiny hammer and lightly tapping it on the knee. The doctor might also give the patient a cognitive or neuropsychological test, which are used to kind of objectively measure the patient's current memory, language skills, math skills, and other abilities as they relate to mental function. And one big one's called the Mini Mental State Examination, or MMSE. And this test can be particularly helpful in diagnosing dementia because it looks at orientation, memory, and attention. For example, it might ask to follow verbal or written commands, or write down a sentence spontaneously, or copy a complex shape. And depending on the score, a certain level of dementia might be suggested. Scores of about 20 to 24 suggest mild dementia, 13 to 20 suggests moderate dementia, and less than 13 would suggest a severe case of dementia. And typically, patients with Alzheimer's disease tend to drop 2 to 4 points on average every year. Another more simple test that might be administered is called the Mini-Cog test. In this test, the patient is asked to name 3 objects and then repeat them back to the doctor, like car, chair, and mug. For the next part, the patient is asked to draw an analog clock, and also asked to draw a specific time. Thirdly, the patient's asked what those 3 objects initially were, car, chair, and mug. If the patient fails one or all of these tasks, it might suggest signs of dementia and may require further evaluation. Another potential test is the psychiatric evaluation, or mood assessment. They'll try to assess the patient's current level of well-being, looking for signs of depression or other mood disorders that can also contribute to symptoms that overlap with dementia symptoms. Finally, the patient might have brain scans. With a brain scan, the brain's actually visualized through techniques like computed tomography, or CT scans, or magnetic resonance imaging, or MRI. And there are several reasons why we might want one of these performed. They might be useful in identifying larger masses, like tumors, that can be contributing to the cognitive impairment. But it might also help in making a differential diagnosis, meaning that we'll try to look to figure out what type of dementia is at play. Sometimes by looking at where the most atrophy of brain tissue is localized, we can figure out what type of dementia it is. For example, atrophy that's localized to the hippocampus might suggest Alzheimer's disease, or the frontal lobe might suggest frontotemporal dementia, or vascular pathologies that are visualized might suggest vascular dementia. And another reason for a brain scan might be to monitor disease progression. Several imaging sessions over several years might show how the brain has changed over time. More atrophy might be indicative of disease progression, whereas if the atrophy has stayed the same over time, it might suggest that a different or a more static cognitive disease is at play. Finally, imaging is really valuable for research purposes, especially with respect to structural imaging and figuring out which structures are affected first by the disease, in addition to any chemical processes that might be involved. And this information helps physicians and researchers alike understand dementia as a disease and develop more effective treatments in the future. Scientists and physicians continue to learn more and more about Alzheimer's disease and dementia in general, but unfortunately they still haven't found a cure. With that said, though, there are medications that can help lessen the symptoms of dementia, like memory loss and confusion. Currently, all the medications approved by the Food and Drug Administration, or the FDA, are aimed at either one of two neurotransmitters, acetylcholine or glutamate. The first class of drugs are cholinesterase inhibitors. Acetylcholine is a really important neurotransmitter in our brain and nervous system. Even though it has important functions in other parts of our body, in our brain it helps our neurons communicate. And it's this communication of our neurons that allows our brain to think and do things like sustain attention, sense things, learn and remember things. Okay, so say we have these two neurons here that are trying to communicate, one transmitting neuron and one receiving neuron. The transmitting neuron releases the neurotransmitter acetylcholine, which then binds to an acetylcholine receptor on the receiving neuron. And this is how these two neurons communicate, right? To sort of regulate this process, though, you have this enzyme that constantly breaks down the acetylcholine that's being released. And this sort of makes sure that too much doesn't build up. And this guy is called acetylcholine esterase. And it breaks acetylcholine down into acetic acid and choline. Think of acetylcholine esterase like Pac-Man, and all these acetylcholines as the little dots that he eats. He's constantly going around eating the dots, but some of them make it by to communicate between the neurons. So it's like this balance, right, of some of the dots being eaten and some communicating. Acetylcholine esterase is a type of choline esterase. So if we throw a choline esterase inhibitor into the mix, like the ghost in Pac-Man, then we inhibit or stop our Pac-Man from doing his job of eating the dots, right? Which means more of these dots build up, and we tilt the balance in favor of the dots, or acetylcholine. Now, patients with Alzheimer's disease, though, already have decreased levels of dots in the first place. So with Pac-Man there, they have even less. But if we inhibit Pac-Man, then we have less dots being eaten, right? And so we end up with more active acetylcholine. And by doing this, by stopping the enzyme that breaks down acetylcholine, we can help neurons communicate in people with Alzheimer's disease. And this medication can help delay worsening of dementia symptoms for about 6 to 12 months on average, for about half of the patients that take them. And although they're usually pretty well tolerated, some side effects can include nausea, vomiting, and loss of appetite. Alright, so that's the first type of medication for Alzheimer's disease. The second type targets the neurotransmitter glutamate, and is called memantine. Just like acetylcholine esterase inhibitors, memantine is prescribed to help patients with symptoms related to memory, attention, reasoning, and language skills. Instead of acetylcholine, though, now we focus on this neurotransmitter called glutamate. Glutamate, when at normal levels, actually helps our learning and memory, and is considered an excitatory neurotransmitter. When glutamate levels get too high, though, it's actually toxic to the cell, and we use a word called excitotoxicity, where the cell gets actually too stimulated and may die as a result. Having too much glutamate is thought to be one possible way that people with Alzheimer's disease lose nerve cells, and therefore have problems with learning and remembering new things. So again, we've got our two neurons, transmitting and receiving, right? And we have this receptor on the receiving neuron called the NMDA receptor, which is also like this channel or gateway that lets in ions to the receiving cell. Now this gateway lets them in when glutamate binds to it. So if there's too much glutamate and this gateway is always open, then the receiving neuron can suffer from excitotoxicity because it's like always being stimulated. Now, memantine blocks this receptor for glutamate, so it keeps this channel closed more. And when it's closed more, we bring down the stimulation to normal levels and avoid killing the cell by overstimulating it. Think of glutamate like this key that opens the door to this party down here, letting all the ions in. If too many get in, though, the party gets too big and too crowded and out of control. If we put a different lock on the door, memantine, then the key won't open it, and the party stays at reasonable levels. Now, memantine is used most often to treat moderate to severe Alzheimer's disease, and will often be taken alongside cholinesterase inhibitors. Some side effects can be things like headache, confusion, and dizziness. So switching gears a little bit, other forms of treatment often target behavioral symptoms like agitation, irritability, aggression, and anxiety. Usually, it's preferred to focus on treatments that don't use medications for these, though, like behavioral modification, since a lot of medications intended to treat behavioral symptoms can actually increase confusion and can even be associated with increased mortality.